Hello, I'm Dr. John Dunleavy from OrthoConnecticut, and I'm a hip and knee replacement specialist, which means that I take care of a lot of patients with hip and knee arthritis. Many patients experience pain in their hips and knees, and we usually start with what I call Plan A to deal with these symptoms. Taking over-the-counter anti-inflammatory medicine, as well as adjusting your activities from higher impact activities to lower impact activities, usually is very helpful. An example would be to switch from running or power walking to using an elliptical machine or a stationary bicycle. Also, strengthening of the muscles around the given joint can sometimes be very helpful, either on your own or with formal physical therapy. And if none of these actions is adequate to deal with your pain and Plan A is not working, then feel free to come into the office at any time to discuss Plan B.